If you're a big swim team and you like to order a lot of gear, maybe you ought to check out Swim Outlet Team Division for these reasons. Swim teams receive a 10% discount on bulk orders. Swim teams or organizations get an 8% commission on referred sales. You'll also like their customization services, which is affordable and available at all times during the year for all team gear. With over 50,000 items in stock, you can get most anything you want. Swim Outlet Team Division. You need to try it out. You'll be glad you did.
This is the Morning Swim Show for Friday, April 11th, 2014. I'm your host, Jeff Commings. The news of Ian Thorpe's emergency trip to the hospital earlier this week to treat serious infection in his arm has spawned online support groups and hundreds of messages from the swimming community wishing the Olympic legend a safe recovery. But what is it about this injury that made it so susceptible to getting an infection? Well, right now and today in the Phoenix Monitor will be Dr. Scott Rodeo. He was the team physician for USA Swimming at the 2004, 2008, and 2012 Olympics. And he joins us now to talk about it via Skype from New York City. Dr. Rodeo, it's good to see you. How are you today? It looks like you're fresh out of the operating room.
I am, just in between cases.
Well, thank you so much for doing it. I know you're very busy. This situation with Ian, he had shoulder surgeries and kind of between surgeries he kind of contracted this infection. Tell us a little bit more about what kind of generally happened.
Well, infections, unfortunately, they do occur after any surgery. They can occur. Luckily, they're uncommon, but it's a recognized risk. Typically, infections come from skin bacteria. It's the most typical source, whether it's a shoulder, a knee, or any other part of the body. So it is a recognized and luckily uncommon complication. When they happen, the important thing is timely diagnosis and careful management.
So what is it about surgeries that make it such a high risk for infection?
Well, just the invasive nature, really. Just the incision certainly provides a route for entry of skin bacteria. Most and many, certainly, infections come from skin bacteria. Strep and staph type of bacteria. I don't know the details of Ian's case, but that's the most typical. Actually, in the shoulder, there's a type of bacteria called P. acnes, which is more common on the axilla. That is definitely a problem for us around the shoulder, and it can happen after shoulder surgery.
How often do you see this in your patients there?
And the overall rate of surgical site infection at our institution is 1 in 400, 0.25%. So not common, but it does occur.
It does occur, and I'm sure when you're talking to these people about surgeries, you tell them that risk does exist.
Absolutely. It's always part of your preoperative discussion, one of the potential risks or complications of any surgery.
Well, I know you're not involved in the treatment of Ian's infection, but if you were, what would be your plan of attack?
Well, the first step is to make an accurate diagnosis with any infections, identify the particular bacteria or organism that causes the infection, because that allows you to choose the appropriate antibiotic. Typically, infections are managed with a combination of intravenous antibiotics as well as surgery. So a surgical site infection, something that occurs following surgery, typically requires further surgery to kind of wash out and kind of irrigate the infected area, but also combine that with intravenous antibiotics. But the important step is to obtain tissue or fluid for culture so we can identify the organism. That helps us choose the appropriate antibiotic.
There are a lot of people watching this show who are very involved in swimming. There's probably a few people watching and hearing of the news of Ian thinking we're probably in the process of considering shoulder surgery for injuries they've sustained during swimming. How often do you personally recommend surgery as an option for rehabilitation?
I see a lot of shoulder injuries and shoulder pain in swimming, and surgery is uncommonly required. Most shoulder problems in swimmers can be managed with appropriate and careful rehabilitation and physical therapy. There are those cases that go on and have persistent pain and that do require surgery, and I've done a number of those over the years, so it certainly is an option for you, but ultimately try to manage most swimming type shoulder injuries non-operatively.
And obviously, the ones that you have to do surgically, what is the rate of success of being able to get someone back in the pool and swimming at the level that they once were?
Yeah, we've looked at our data and published some of our results, about 85% as far as return to activity. So, the results are good. They're not perfect. There are certainly room for improvement. It's a tough group. Basically, the loads are very high in the shoulder and swimming with the repetitive overhead activity. So it's a challenging group.
Of those 15% who usually aren't able to get back into form, what is usually the main reason why they're not able to?
Yeah, there's a group of patients that are better, but they're not quite better enough to be able to train. They can typically return to training, but that group is a group that they can't return to the level they want to their formal level of training or competition. So it's usually a lesser level, and it's usually pain. A number of factors that can lead to that.
Obviously, as I know you were a former swimmer, you hung out with swimmers at the Olympic Games for 3 Olympic Games. What can be done in swimming to reduce the risk of shoulder injury to the point where you might need a surgery?
A lot of the problem in swimming relates to kind of muscle overuse and muscle fatigue. And when the muscle fatigue around the shoulder, that affects the mechanics of the joint. So the point is, the best preventive measure is a comprehensive strengthening program for all the muscles around the whole shoulder girdle. And that's not just the rotator cuff, but all the muscles around the shoulder blade, core muscles, upper back, abdominal muscles. Really, a comprehensive program is the single best thing athletes can do in a preventive fashion.
So obviously, with swimmers having to stay away from a lot of these strong drugs, these painkillers, because of the fact that they're on the World Anti-Drug banned list, what can be done outside of medication to make sure that they're kind of reducing the level of pain and not wanting to get themselves into trouble?
Sure. Well, there are medications that are allowed. Anti-inflammatories, things like that are really our best option. They're not perfect, but they certainly can be helpful, especially managing postoperative pain. But then a lot of different things we can do, modalities, working with the therapist, things like ultrasound and different modalities like that you can do with the therapist help to diminish and control inflammation around the joint. A lot of the pain comes from inflammation, so anything we can do to minimize and improve that is helpful.
And something that was had been mentioned in Ian's story is that he became dependent on a lot of the medicines that he had been using, and to the point where he had to go to rehab. Is that something that's very typical?
No, it's luckily uncommon. I've seen it sometimes in various patient groups, but it's tough. But that's luckily uncommon. But it just speaks to the issue of carefully and comprehensively managing your patient, identifying all the issues, and then getting the appropriate help. Get the appropriate specialist to help you. If you need someone to help with the pain management side of things, do that. And we have some good expertise to help us do that.
A lot of reports are saying also that because of this infection, because it's so serious and kind of got so deep into his shoulder, that the possibility of Ian not swimming competitively again is very high, that he will not be able to make the comeback that he has expected. Do you agree with that prognosis?
Yeah, it depends a lot on the specific case, but the issues with any infection are kind of twofold. One is stiffness. Infection around a joint, ultimately you can and they will eradicate the infection, but the problem can be stiffness can remain in a joint that's had infections. That's problem number one. Number two is over time, and this is more long-term, there's a risk of post-infectious arthritis. Essentially, the infection can damage the joint surface and does heighten the risk of arthritis down the line, in the future. Now, in his case, I think he's had a fracture. One concern I would have would be infection can slow or impair fracture healing as well. So there's a number of considerations here that need to be, some are short-term, some are longer-term, but that are all typical after infection.
I think the main thing to take away from here is take care of your shoulders now and try to prevent this as much as possible.
That's for sure. An ounce of prevention's worth a pound of cure, right?
Oh yes, absolutely. As I said, you were a swimmer yourself. Did you ever have any issues with your own shoulders?
I did. In fact, I kind of got involved in sports injuries and sports medicine through my own problems, largely with shoulder problems as a swimmer, interestingly.
Yeah, I think I've talked with a lot of college students who say because they've spent so much time in rehab, they're interested in medicine. So
right.
It's a natural path, I guess. Well,
right.
Dr. Rodeo, thank you so much for joining us and giving us a little more insight into specifically, the inside of the shoulder and kind of what's going on, not just with Ian, but kind of in general. And hopefully this will bring some more light to the issue and kind of calm a few fears out there.
Sure. Thank you. Happy to help. Thank you very much.
All right, have a good rest of the day, and have a good rest of your surgeries today.
Yep, off to do one. Thank you.
All right.
Bye-bye.
All right, so that's going to do it for today's edition of the Morning Swim Show. I hope you learned a lot. I'm sure did as well. I'm Jeff Commings. Thanks for watching.